crisis. Third, we need to step up, not step back, on the commitment to aid as 0.7 of gross national income by the developed countries. This is not the time to step back. This is the time to step up in global solidarity. And fourth, there is a recognition of a need to expand fiscal space, and the international financial institutions have agreed on issuing a historic issuing of special drawing rights. This amount of 650 billion US dollars that has been agreed, only 3.3% of it, that's 22 billion, is set to flow to sub-Saharan Africa, the region with the highest burden of HIV and of infectious diseases. This is the region most in need. The amount that is going to come to the African countries is even smaller than the external debt repayments scheduled for 2021. There's a need for the G7 as they come together tomorrow to look at how to have a fairer distribution of the special drawing rights resource flows. We have estimated that we need $29 billion annually to provide the HIV services needed globally, and this is the target to reach in 5 years' time. This is not a huge amount of money when you consider that developed countries are putting trillions of dollars into the recovery of their own economies from the COVID pandemic now. It is achievable if there is political will and global solidarity. The fifth and last action is what David Wilson talked about, that of developing countries with a high burden of HIV, to prioritize, indeed all countries, to prioritize human capital investments in health, education, and social protection as key for lifting everybody out of this crisis, and key also for protecting economies. In order to get out of this crisis, in order to end AIDS, we must put more in strengthening our health systems, invest more, and systems that are inclusive and that work for everybody and leave no one behind. We must stamp out waste and corruption from our systems so that every dollar is spent for the health of our people. Those are the 5 things that I would put down as key for us to be able to end AIDS by 2030. Together, we can achieve this. Together, with global solidarity and with our path of the political declaration, we will be able to defeat AIDS by 2030. Thank you. And back to you, Chair.
Thank you very much, Ms. Byanyima, for these points. I think we now have 10 more minutes to go, so what we will do is have a final round of 1 minute, just 1 minute for a final comment from each of the panelists, and then I will move the word back to our chair to close the session with his concluding remarks. So we will start in the same order as we have proceeded. First with the Vice Minister, Kilumba. Please, Madam Vice Minister, you can have the floor for a last minute. Well, while we get, I think. I'm not sure we are going to have the Vice Minister right now, so I'm going to move to Mr. Peter Sands. Please, Mr. Sands, can you give us your last minute with your kind of highlights?
Thank you. Just building on some of Winnie Byanyama's comments, one thing I think we can learn from the COVID-19 response is the power of life sciences, as David Wilson says, but also the value of speed, of moving rapidly, of having a sense of urgency in the response. And I think we have, in a sense, been too accustomed to not moving as fast as we can. And I think we should reset our aspirations around how rapidly we roll out innovations, how rapidly we react to situations unfolding where we see increases in new infections. And that is one very powerful lesson, I think, that we can take from the COVID-19 response, and that will enable us to channel and use our resources more effectively.
Thank you very much, Mr. Sands. Mr. David Wilson, your last minute.
Thank you very much indeed. I will make 2 closing points. The immediate challenge before us is global vaccine equity, so that the recovery that's begun in high vaccinating countries can be shared and we can begin a true global recovery. And then my second point is we need to make sure that we recover what's lost. If we do not, we face a world that may be dominated by behemoths, which are harder to tax, and by informality, which is also harder to tax. And we will have a world of greater marginalization. And HIV, more than anything else, underscores the critical role that marginalization plays in ill health. And we see that in COVID too, where maps of high COVID concentration are in essence maps of economic deprivation. We need to achieve high levels of vaccination, and then we need to build a much more equal society. Thank you.
Thank you, Mr. Wilson. I'm passing it over now to Professor Kamarulzaman for your last minute remarks.
Science has given us the tools to prevent and treat HIV/AIDS and eventually to end the pandemic, hopefully by 2030. So we must use all these tools that we have now to ensure that it reaches, the globe and not just in in rich countries, so that we will, reach the global targets that we have set ourselves. Thank you very much.
Thank you very much, Professor. I see that we no longer have the Vice Minister with us, so we have concluded the panel. I want to thank you very much, our exceptional panelists, for a great session, member countries, member states, and the intervention of the UNAIDS Executive Director for the great quality and the depth of this debate. I'm now passing the word back to the Honorable Chair with my thanks too.
Thank you very much indeed for a truly rich discussion. And Mr. Moderator, really appreciate you navigating us through this. It has indeed been 40 years since the pandemic on AIDS, and it's really unimaginable what we have experienced in 2020, and the issues of vaccine nationalism, vaccine commercialization, and therefore the global vaccine inequities that have emerged have been quite saddening, because we have really been overcome by what I'll call a spiritual stupor, which is really challenging our common humanity. And so we need to really circle the wagons to ensure that the AIDS pandemic has the funding that it is required. So allow me to close this panel by first thanking the panelists and the member states and colleagues who participated from the floor for their rich interventions. We all understand, and perhaps my colleague finance ministers even more so, I in particular had a COVID experience and a post-COVID experience, which really brought the nexus of finance and healthcare together for me for the first time in a rather graphic way. And that really changes one's perspective on these issues. So there are many competing needs to achieve the 2030 goals of the SDGs across a full range of health, social, and environmental needs, and to get to our 2030 targets for AIDS. But in the face of these challenges, we must remain clear and focus on the goals. Political leadership, community-led responses, and global solidarity must mobilize and effectively use the $29 billion annually by 2025 to accelerate progress towards achieving the targets. There are many ways to get there, and certainly the private sector can help. But I think it's a choice for finance ministers in African countries, even given the effect of the COVID pandemic. Africa loses some $88 billion a year in illicit funds flows out of the continent, and that more can cover our needs for AIDS. And 63% of these are by commercial entities, which are mostly in the West. So we can come together to focus on this and reverse this trend. Dozens of countries across a range of epidemic settings and economic status successfully reached the 2020 AIDS response targets and brought the epidemic under control. In 2020, 27.4 million of the 37.6 million people living with HIV were on treatment, up from 7.8 million in 2010. This progress should steer us towards rapid action and the better use of existing funds. A comprehensive funding of the AIDS response requires all of us to work together if we are to end the AIDS pandemic. Africa, of course, is going through its first recession in 25 years, and this exogenous shock we've seen nothing like that since 1873. And for Africa itself, quite a number of changes have occurred. We contracted by 2.2% this year, and almost 25% of our people were laid off during this time. 39 million people or so were pushed into extreme poverty, and 113 million lost their jobs in this short time. In addition to that, our debt to GDP ratio moved from 52% to 70%, putting us on the precipice of liquidity and insolvency that is upon us. We calculate that some $63 billion will be needed in the next 2-3 years to support our health infrastructure and fight against the COVID-19 pandemic. So there has to be some intentionality. And in Ghana, we have a law that we are going to action with a National HIV/AIDS Fund to put some seed money of $100 million or so over the next 5 years. And I think that's the type of intentionality that is required, and to bring private sector on board to support that and the NGO community. So let us act now to protect the gains we have made and institute resilient systems that ensure that the HIV response is not further set back because of the COVID-19 pandemic and potential impact on HIV services. So we should not withhold the good from those to whom it is due when it is in your power to do so. It's a quotation for Proverbs, and we should insist on that. I would like to thank Mr. Jer Matienza, the moderator, for ably moderating us through this, the panelists and all the participants for their active engagement in the third thematic panel. Before concluding, members are reminded that the 76th plenary meeting will take place immediately after the conclusion of this panel discussion. The third thematic panel is now concluded, and really thank you for the honor of chairing this meeting. Thank you.
Good afternoon. The 76th plenary meeting of the General Assembly is called to order. The General Assembly will continue its high-level meeting of the General Assembly on HIV/AIDS under Agenda Item 10, entitled Implementation of the Declaration of Commitment on HIV/AIDS and the Political Declarations on HIV/AIDS. Before we begin with the list of speakers for the general debate, I would like to address important organizational matters pertaining to the conduct of the plenary meetings. Introduction of the pre-recorded statements will be made by the representatives from their national seats. Due to time constraints, it's expected that the introductory remarks will be kept concise. Statements delivered by the high-level representatives who are physically present in the Assembly Hall can be made from the national seats or the rostrum. As set out in Resolution 75/260, statements in the general debate will be limited to 3 minutes for individual delegations and 5 minutes for statements made on behalf of a group of states. In the case of pre-recorded statements, introductory remarks and length of the video itself shall be counted in the allocated time limit. In accordance with Decision 75/563, in addition to the verbatim records of the high-level meeting, the President of the General Assembly will circulate as a document of the Assembly a compilation document of the statements delivered by means of pre-recorded statements during the high-level meeting and submitted to the President no later than the day on which the pre-recorded statement is played in the Assembly Hall, and that such pre-recorded statements will be attached to the verbatim records of the meeting. Submissions in this regard should be made to e-statements@un.org. I now give the floor to the distinguished representative of Gambia to introduce an address by the Vice President.
Thank you, Madam Vice President. I have the honor to introduce Her Excellency Dr. Aissatou Touré, Vice President of the Republic of the Gambia, to deliver her recorded statement at the UN High-Level Meeting on HIV and AIDS. Thank you.
President of the General Assembly, Excellencies, distinguished participants, ladies and gentlemen. On behalf of His Excellency, the President of the Republic of the Gambia, I am indeed honored to participate in the 2021 high-level meeting on HIV and AIDS. We made history in 2001 when for the first time the United Nations General Assembly called for a high-level meeting devoted to a specific health issue. This was the United Nations Special Session on HIV and AIDS. Without doubt, the preparation of such a high-level meeting has been a lengthy, coordinated, and consultative process led by and directed by the President of the United General Assembly. On behalf of the Gambian people, I therefore wish to thank the General Assembly for organizing yet another high-level meeting on HIV and AIDS. This unprecedented meeting will certainly redirect global focus and generate high hopes for enhanced political commitment that will help halt and reverse the spread of HIV and AIDS globally. At the last United Nations high-level meeting on HIV and AIDS, held in 2016 in New York, we committed to ending the AIDS epidemic as a public health threat by 2030, in line with the 2030 Agenda on Sustainable Development, which was adopted by the UN General Assembly in 2015. The commitment we made in 2016 in New York include specific targets on HIV testing and treatment, so that 90% of people living with HIV/AIDS know their HIV status. 90% of people diagnosed with HIV are put on antiretroviral therapy, and 90% of those on treatment achieve sustained viral suppression, with the aim of achieving record reductions in new HIV infections, deaths, and illnesses. Without doubt, the gains made towards meeting these targets continue to contribute to the overall progress towards the 2030 Agenda for Sustainable Development and the global health goals. This year's high-level meeting on HIV and AIDS comes in the midst of another pandemic, COVID-19. There is ample evidence that the COVID-19 pandemic is threatening access to HIV prevention, testing, treatment, and care services. Without appropriate strategies to mitigate these threats, therefore, we risk seeing a situation that would derail our public health response to HIV and AIDS. It is therefore befitting to use the 2021 high-level meeting as a springboard for a decade of action to reduce inequalities and root out the social determinants that fuel the HIV pandemic. As we adopt a new declaration, therefore, we must affirm our present commitments and identify realistic actions to guide and sustain the global AIDS response in the future. In this regard, and as a member state, the Gambia remains strongly committed to working with the development community to ensure a more effective global response to HIV and AIDS. Undoubtedly, the COVID-19 crisis was not the least anticipated, and it has unmasked serious weaknesses in our national health systems. As a country, we will continue to scale up community-led HIV prevention, testing, and treatment by addressing social enablers, youth empowerment, gender inequality, and ending gender-based violence, as well as stigma and discrimination. The Gambia government will also continue to prioritize key populations, adolescents, girls, and young women in our national response. We must therefore remain united in the global HIV response. Together, we can defeat AIDS, leaving no one behind. I thank you for your attention.
I wish to thank the Vice President of the Republic of the Gambia for the statement just made. I now give the floor to the distinguished representative of Côte d'Ivoire to introduce an address by the Vice President.
Merci, Madame la Présidente. Madame la Présidente, j'ai l'honneur de présenter la déclaration préenregistrée de M. Pierre Demba, ministre de la Santé, de l'Hygiène publique et de la couverture maladie universelle de la République de Côte d'Ivoire.
Secrétaire général des Nations Unies, Excellences, Mesdames et Messieurs les chefs de délégation, la Côte d'Ivoire tient à féliciter les Nations Unies pour l'initiative d'organiser cette réunion de haut niveau sur le VIH-Sida. La réunion de ce jour se tient dans un contexte sanitaire mondial marqué par la pandémie de Covid-19, dont l'impact a été considérable sur la continuité des services de lutte contre le VIH-Sida dans notre pays, ainsi que sur les chaînes d'approvisionnement des médicaments antirétroviraux. Au cours de la dernière décennie, notre pays a enregistré des progrès en matière de lutte contre le sida, grâce aux efforts conjugués par le gouvernement, appuyés par des partenaires techniques et financiers. Les principaux indicateurs montrent que la prévalence de l'infection à VIH a reculé dans la population générale, passant de 4,7% en 2005 à 2,1% en 2020. De même que le nombre de personnes vivant avec le VIH a connu une baisse, passant de 430 000 personnes en 2015 à 380 000 personnes en 2020. L'accès gratuit aux traitements antirétroviraux a été généralisé dans toutes les régions de notre pays, avec 280 000 personnes vivant avec le VIH-Sida sous traitement. Excellences, Mesdames et Messieurs, Concernant les 3,90, les résultats obtenus en 2020, bien qu'encourageants, sont en deçà des objectifs fixés dans la déclaration de politique de 2016 de l'ONU-SIDA, en particulier chez les enfants. Nous mesurons donc les efforts qu'il nous reste encore à faire pour atteindre les objectifs qui ont été traduits dans notre plan stratégique national de lutte contre le sida sur la période 2021-2025. Pour les années à venir, des stratégies innovantes seront développées pour dépister le VIH à travers une offre diversifiée chez des cibles prioritaires qui sont les jeunes et les femmes enceintes, ainsi que certaines couches de population. Excellences, Mesdames et Messieurs, malgré les contraintes imposées par la pandémie à Covid-19, nous réitérons notre engagement à éliminer le sida comme problème majeur de santé publique à l'horizon 2030, sous le leadership des Nations Unies. La Côte d'Ivoire marque donc son accord et adopte la nouvelle stratégie mondiale de lutte contre le sida sur la période 2021-2026, intitulée « Mettre fin aux inégalités, mettre fin au sida ». Je vous remercie.
I thank the Minister of Health, Public Hygiene and Universal Health Coverage of Côte d'Ivoire for the statement just made. I now give the floor to the distinguished representative of Argentina to introduce a statement by the Minister.
Muchas gracias, señora presidenta. Tengo el honor de presentar la declaración pregrabada de la ministra de Salud de la República Argentina, doctora Carla Bisotti, en ocasión de esta reunión de alto nivel sobre HIV-Sida. Gracias.
Señor presidente de la Asamblea General, señora vicesecretaria general, señora directora ejecutiva del Programa Conjunto de las Naciones Unidas para el VIH-Sida, ONU-SIDA, delegados y delegadas de los Estados miembros y observadores, representantes de la sociedad civil. Es un honor para Argentina haber sido invitada a participar en este evento, especialmente a los 40 años del primer caso de síndrome de inmunodeficiencia adquirida reportado en el mundo y a 25 años de la creación del Programa Conjunto para VIH-Sida de las Naciones Unidas, ONU-SIDA. El mundo en su conjunto y América Latina en particular está atravesando una difícil situación sanitaria, económica y social, producto de una pandemia que ha puesto de manifiesto de manera dramática las vulnerabilidades e inequidades de los sistemas sociales, políticos, económicos y sanitarios a nivel global. En este contexto, nuestro país entiende que las políticas sanitarias nacionales deben focalizarse en acciones colectivas con el objetivo de poner fin a la epidemia de SIDA para el 2030, en línea con los objetivos de desarrollo sustentable. Garantizar el derecho equitativo a los medicamentos contra el VIH, las hepatitis virales y la tuberculosis debe ser una prioridad para los Estados, ya que resulta una condición necesaria para promover el efectivo goce del derecho a la salud de todas las personas. La coyuntura global actual ocasionada por la pandemia de COVID-19 no debe impedir a los Estados avanzar en una respuesta eficaz, superando barreras globales de derechos humanos, laborales y de género que garanticen el acceso equitativo en materia de prevención, diagnóstico, tratamiento y atención al VIH. Los Estados deben comprometerse con la reducción del estigma, la discriminación, la criminalización a través de políticas específicas destinadas a poblaciones claves en situación de vulnerabilidad y de menor acceso, como las personas con VIH, las personas privadas de la libertad, las personas que ejercen trabajo sexual, las personas que usan drogas, la población LGBTI+, lesbianas, gays, bisexuales, transexuales, intersexuales, no binarias, entre otras, mujeres cis y trans, niñas, jóvenes y adolescentes, personas con discapacidad, minorías étnicas y raciales, pueblos indígenas, afrodescendientes, personas en situación de pobreza y pobreza extrema, migrantes, refugiados, personas desplazadas, personal de asistencia humanitaria y en situaciones de conflicto. Para poner fin a la epidemia de VIH para el 2030 es necesario poner a las personas y a las comunidades en el centro de la respuesta, abordando las desigualdades e inequidades, movilizando recursos y financiamiento para una respuesta efectiva, promoviendo la igualdad de género y el derecho a la autonomía corporal, garantizando los derechos sexuales y reproductivos, así como empoderando mujeres y niñas. Por último, y en línea con los debates que se está desarrollando en la OMC, creemos que esta situación representa una oportunidad sin precedentes para licenciar los derechos de propiedad intelectual, liberar las patentes y ampliar la capacidad de producción para evitar que se siga postergando el acceso a medicamentos esenciales, como los tratamientos contra el VIH, las hepatitis virales y la tuberculosis, a las poblaciones más vulnerables. Muchas gracias.
I thank the Minister of Health of Argentina for the statement just made. I now give the floor to the distinguished representative of Paraguay to introduce a statement by the Minister.
Muchas gracias, señora Presidenta. Es un honor presentar la intervención del señor Ministro de Salud Pública y Bienestar Social del Paraguay, doctor Julio Borba.
Señor Presidente, la lucha contra el VIH y SIDA en el Paraguay constituye una prioridad en el área de salud y una política de Estado enfocado en garantizar el respeto, la protección y la promoción de los derechos humanos en el tratamiento de las personas que viven y son afectadas por el VIH y el SIDA, así como en establecer las medidas preventivas para evitar la transmisión. Desde el inicio de la epidemia en nuestro país, en el año 1985, se han registrado más de 7.000 muertes relacionadas con la enfermedad y se han diagnosticado a más de 16.632 personas que viven con la enfermedad. Si bien la epidemia se ha mantenido estable en los últimos años, el desafío es seguir avanzando y ampliando la respuesta multisectorial al VIH-Sida, fortaleciendo el trabajo coordinado en las comunidades y con las comunidades. En el Paraguay, esta respuesta está liderada por el Ministerio de Salud Pública y Bienestar Social a través del Programa Nacional de Control del VIH-Sida, ITS, y en el marco del compromiso de poner fin a la epidemia en el año 2030. Abordamos la problemática del VIH-Sida desde la prevención, diagnóstico, tratamiento, la supresión viral, los derechos humanos y la eliminación del estigma, la discriminación y la violencia de género, acompañados de un fuerte liderazgo comunitario que nos encamina a ir disminuyendo las desigualdades. Señor Presidente, mi país se une a los esfuerzos mundiales dentro del marco de la nueva Estrategia Global del SIDA 2021-2026 y teniendo presente que la epidemia del VIH-Sida en el Paraguay se encuentra especialmente concentrada y afectando a ciertos grupos de la población, como los hombres que tienen relaciones sexuales con otros hombres, las trabajadoras sexuales, las personas transgénero, las personas privadas de libertad y los pueblos indígenas, trabajamos en avanzar en proyectos sociales y de alcance comunitario para lograr mejoras en la salud pública con servicios integrados, conscientes de que la información y la educación son elementos esenciales para lograr la plena realización del derecho de toda persona al disfrute de la salud física y mental. Expresamos nuestra profunda preocupación por la pandemia del COVID-19 y su impacto en el contexto del VIH-Sida y otras enfermedades transmisibles y no transmisibles. Vemos que se han ralentizado los progresos debido a la pandemia y que se agudiza aún más en las poblaciones clave y en las vulnerables. En este sentido, consideramos que un enfoque de solidaridad mundial y responsabilidad compartida impulsará las acciones y generará una importante reducción en las nuevas infecciones y muertes relacionadas con el SIDA, así como toda forma de estigma y discriminación, respetando los derechos humanos y la diversidad cultural. Quisiera concluir haciendo un llamado a los Estados, al sistema de las Naciones Unidas y a las organizaciones regionales, así como al sector privado, la sociedad civil, la academia, incluida la comunidad científica, a reorientar las acciones para fortalecer la respuesta multisectorial al VIH-Sida y poner fin a esta epidemia. Muchas gracias.
I thank the Minister of Health and Social Welfare of Paraguay for the statement just made. I now give the floor to the distinguished representative of Equatorial Guinea to introduce an address by the head of state.
Muchas gracias, señora presidenta. Tengo el altísimo e insigne honor de introducir a su excelencia Obiangema Mbazogo, presidente de la República de Guinea Ecuatorial, quien va a proceder a su intervención. Muchas gracias.
Excelentísima señora directora ejecutiva de UNICIDA, excelencias, señoras y señores, ante todo quiero agradecer a la señora Winnie Byanyima, directora ejecutiva de UNICIDA, por invitarme, y me complace participar en nombre de la República de Guinea Ecuatorial en esta importantísima reunión de alto nivel sobre VIH-Sida, que coincide con el 40 aniversario del primer caso diagnosticado del SIDA y la celebración del 25 de efeméride de ONU-SIDA, al que felicito por su plena dedicación a esta cuestión en los años de su existencia. Estamos hoy a 5 años de la adopción de la resolución 70/266 de la Asamblea General de las Naciones Unidas, que contiene la declaración política sobre el VIH y el SIDA, en la cual los Estados reafirmamos nuestro compromiso ya reflejado en la Agenda 2030 del desarrollo sostenible, de acelerar la lucha contra el VIH y poner fin a la epidemia del SIDA para el año 2030. En Guinea Ecuatorial, la lucha contra el VIH-Sida no ha dejado de ser una prioridad de política nacional. Dentro de nuestros esfuerzos, el Gobierno adoptó la Ley número 3/2005 de fecha 9 de mayo sobre la prevención y la lucha contra las infecciones de transmisión sexual VIH-Sida y la defensa de los derechos humanos de las personas afectadas, que implica poner fin a las desigualdades y encaminarse para acabar con el SIDA de aquí a 2030. Igualmente, el Gobierno asume desde hace varios años el financiamiento del 100% del diagnóstico y tratamiento del VIH-Sida, siendo este de carácter gratuito, lo que garantiza el acceso al tratamiento y constituye una oportunidad importante para el logro del objetivo de su erradicación. El país cuenta actualmente con 8 centros de TAR, 36 centros que ofrecen la PTMH en rutina, y la prueba de VIH es disponible a todos los niveles en los laboratorios. El objetivo del Gobierno es descentralizar el TAR en hospitales generales y centros de salud del ámbito nacional. Pese a estos esfuerzos, somos conscientes de que hay todavía trabajo por hacer hasta la erradicación del VIH-Sida. Es importante que las autoridades competentes sigan trabajando en los programas de sensibilización para concienciar a la población, sobre todo a los jóvenes. Guinea Ecuatorial acoge con beneplácito la opinión de que aunamos esfuerzos internacionalmente para reducir las desigualdades entre los países y dentro de cada uno de ellos, con el fin de fortalecer así la capacidad mundial de contener y derrotar los futuros desafíos mundiales en materia de salud que ponen en riesgo vidas y medios de subsistencia en todo el mundo. La erupción de la pandemia de la COVID-19 y sus trágicas consecuencias no debería distraernos de la lucha contra el VIH-Sida, que ha causado muchas pérdidas de vidas humanas y todavía no tiene vacuna, lo que subraya todavía su alta letalidad. La determinación mostrada en la erradicación del COVID-19 debe tener su continuidad en los esfuerzos por limpiar a la humanidad del VIH-Sida y las experiencias y lecciones aprendidas deben ayudarnos a tener sistemas de salud más prósperos y avanzados. Por último, queremos agradecer a las delegaciones de Australia y Namibia por la loable labor realizada como facilitadores de la declaración política sobre VIH-Sida que Guinea Ecuatorial apoya. Muchas gracias.
I thank the President of the Republic of Equatorial Guinea for the statement just made. I now give the floor to the distinguished representative of Norway to introduce a statement by the Minister.
Thank you, Madam President. I have the honor to introduce the pre-recorded statement by Mr. Dag Inge Ulstein, Minister of International Development of Norway.
Honorable delegates, the COVID-19 pandemic has made the inequalities of the world more visible, and it has increased these inequalities. As always, the most vulnerable groups are hit the hardest. It has made it more difficult to reach our 2030 ambitions, but it has also made it more important that we do, not least on HIV. HIV and AIDS remains a serious threat to public health, but its history also shows what can be achieved. What was once a death sentence does not longer, once the conditions are right, stand in the way of living a long, happy, and meaningful life. Both the coronavirus and HIV thrive when there are inequalities and discrimination. Therefore, we strongly support the recently adopted Global AIDS Strategy for 2021 to 2026. And inequalities and AIDS. It sets ambitious goals, it sets the right goals. In 2021, the HIV endemics around the world disproportionately affect groups in vulnerable and challenging positions. We need to understand and address sensitive issues, including how people conduct their very private sexual lives, and we need to address substance use. HIV prevention is critical. We must focus on the needs of young people in all their diversity, including if they live with disability or mental health challenges. Addressing harmful gender attitudes and practices is decisive. So is quality education, including comprehensive sexuality education and securing sexual and reproductive health and rights for all. We have to focus on key populations of all ages, and every country needs to assess and address their needs. Community-led approaches to HIV have demonstrated their effectiveness. Civil society initiatives are crucial to help provide access to a range of health services in a country. We are concerned that pediatric HIV diagnosis and treatments is lagging behind. More efforts is needed to better integrate HIV into maternal and child health care. Norway will remain a strong supporter in the response to infectious diseases such as HIV, tuberculosis, malaria, and COVID-19, as well as non-communicable diseases. We must use our experiences from the colliding pandemics of AIDS and COVID-19 to build resilience against future challenges. We still believe human rights-based approaches will make it possible to prevail in the race toward 2030. We must work with people, not against them. Thank you.
I thank the Minister of International Development of Norway for the statement just made. I now give the floor to the distinguished representative of Liechtenstein to introduce a statement by the Minister.
Thank you, Madam President. Madam President, I have the honor to introduce the pre-recorded statement from Her Excellency Dominic Hasler, Minister of Foreign Affairs, Education and Sport of the Principality of Liechtenstein. Thank you.
Mr. President, it's an honor to speak before the General Assembly on the HIV/AIDS response, a true success story of multilateralism and international solidarity spearheaded by the United Nations. Since the first special session 20 years ago, we have scaled up collective action with quite remarkable results. AIDS-related death has fallen by 60% since the peak in 2004. And the annual number of new HIV infection has declined by more than 1/3 since 2001. But these figures also make it clear that far too many people still die preventable death and get infected. HIV/AIDS continues to have wide-ranging health and socio-economic effects and comes with stigma and discrimination of those affected and those at risk. The COVID-19 pandemic has exacerbated the situation. A pandemic of inequalities, in the word of the Secretary General. HIV/AIDS affects certain regions and key population disproportionately. Inequalities are obstructing progress in fighting HIV/AIDS. We must do more to address them if we want to win this fight. The 2030 Agenda provides all the tools to holistically achieve good health and well-being and to leave no one behind. Especially SDG 16 for effective, accountable and transparent institutions at all levels remains a cornerstone in effectively responding to pandemics, but also in preventing them from occurring in the first place. And the rule of law is a proven prerequisite to achieve healthy lives and well-being as reflected in SDG 3. The guidance and leadership by UNAIDS has been pivotal for our collective action, as has the work by the Global Fund Against HIV/AIDS and relevant civil society organizations. Since 2007, Liechtenstein has contributed to UNAIDS, and we aim at continuing our support. The fight against HIV/AIDS is not only about our health and well-being, but also about respecting human rights and fundamental freedoms, and setting the stage for more peaceful, just, inclusive and prosperous societies. I thank you.
I thank the Minister of Foreign Affairs of Liechtenstein for the statement just made. I now give the floor to the distinguished representative of Guatemala to introduce a statement by the Minister.
Muchas gracias. Tengo el honor de presentar a la doctora María Amelia Flores González, Ministra de Salud Pública y Asistencia Social de Guatemala, quien dirigirá un mensaje en el marco de esta importante reunión de alto nivel sobre VIH-Sida.
Buenos días a todos. Señor Presidente de la Asamblea General de la Organización de las Naciones Unidas, Volkan Bozkir, agradezco convocar a esta reunión de alto nivel sobre el VIH-Sida. Me complace participar en esta reunión, reafirmando que el Gobierno de Guatemala se suma al llamado a la acción a través de la declaración política que hemos adoptado para poner fin a las desigualdades y encaminarse para contrarrestar el virus de la inmunodeficiencia humana, acelerando el progreso hacia el logro de los Objetivos de Desarrollo Sostenible, en particular el ODS 3 sobre salud y bienestar. El Ministerio de Salud Pública y Asistencia Social de la República de Guatemala, a través de sus diferentes niveles de atención, ha realizado esfuerzos a través de la implementación de la Ley General para el Combate al Virus de Inmunodeficiencia Humana y del Síndrome de Inmunodeficiencia Adquirida, que contempla la adopción de mecanismos necesarios para la educación, vigilancia epidemiológica, investigación, atención y seguimiento de los casos, así como garantizar el respeto, protección y defensa de los derechos de las personas afectadas por esta enfermedad. Para el año 2020, en Guatemala se estimó una incidencia de VIH de 0.05% por cada 1,000 habitantes. De enero a diciembre de ese mismo año, se reportaron un total de 1,606 nuevos casos positivos de VIH al Programa Nacional de SIDA. Es por ello que a través del Programa Nacional de ITS-VIH-SIDA del Ministerio de Salud Pública y Asistencia Social, continuamos asegurando la atención y la provisión de medicamentos para todas las personas diagnosticadas. Señor Presidente, con el propósito de generar una participación inclusiva y no dejar a nadie atrás, el Ministerio de Salud Pública y Asistencia Social llevó a cabo una consulta multisectorial para discutir las principales prioridades estratégicas con miras a la implementación de la nueva Estrategia Mundial del SIDA. Es por ello que quiero destacar que el rol de la sociedad civil, pueblos indígenas, las poblaciones clave, las mismas personas que viven con VIH o que están en riesgo de sufrirlo, son actores importantes para asegurar la condición de sostenibilidad en la respuesta del VIH y coadyuvar a las acciones que están en ejecución a través del apoyo de la cooperación internacional. Nuestro compromiso es llevar atención integral a la población, trabajando para ampliar la cobertura en el diagnóstico y tratamiento, esforzándonos cada día para tener espacios libres de estigma y discriminación que permitan brindar atención con calidad y calidez. Muchas gracias.
I thank the Minister of Health and Social Assistance of Guatemala for the statement just made. I now give the floor to the distinguished representative of Kazakhstan to introduce a statement by the Minister.
Madam President, I have the honor to introduce the pre-recorded statement by Mr. Alexei Tsoy, Minister of Healthcare of the Republic of Kazakhstan. I thank you.
Mr. President, Mr. Secretary General, Excellencies, ladies and gentlemen, the government of the Republic of Kazakhstan consistently pursues a policy to curb the spread of HIV infection, recognizing that the problem is one of the priorities, global or UN or national priority. As part of implementing the SDGs and the mandate of UNAIDS to stop the spread of AIDS by 2030, Kazakhstan has established a universal access to HIV testing and treatment, with 83% of HIV patients today being aware of their status. Kazakhstan is the only country in the Central Asia that has HIV treatment covered entirely by the government. In addition, maternal and child health has always been one of the main state priorities. We have thus achieved remarkable success in halting the vertical mother-to-child HIV transmission, not only in comparison to the Central Asian region, but also to the global level. We have furthermore successfully implemented the Global Fund projects on the HIV component. I would like to note that Kazakhstan has gradually made a transition from donor funding to the government taking full fiscal responsibility for their own HIV prevention programs. As a result of our ongoing epidemic prevention efforts, the HIV prevalence in Kazakhstan remains in a relatively low, concentrated stage, 0.2% of the population, which is significantly lower than the average incidence in Eastern European and Central Asian countries. Dear colleagues and participants, today we are adopting a new political declaration for the next phase, 2021-2026, which contains new, visionary and ambitious goals. The declaration should be seen not only as a document that addresses current gaps and shortcomings, but also as a tool for creating new opportunities to address the HIV and AIDS epidemic, both at the national and international levels. Success in implementing the HIV declaration depends on our coordinated work between different stakeholders, including the state, non-governmental organizations, and the community of people living with HIV. I am confident that our joint efforts will bring an end to the HIV and AIDS epidemic around the world. Finally, Kazakhstan affirms its intentions to implement the goals embraced by the world community and is committed to be a trusted partner in the multilateral action in the fight against HIV/AIDS. Thank you for attention.
I thank the Minister of Healthcare of Kazakhstan for the statement just made. I now give the floor to the distinguished representative of Armenia to introduce a statement by the Minister.
Thank you, Madam President. I have the honor to introduce a pre-recorded statement by Her Excellency Anait Avanesyan, Acting Minister of Health of the Republic of Armenia.
Honorable delegates, distinguished colleagues, on behalf of Armenian delegation, I would like to warmly greet the organizers and participants of the General Assembly high-level meeting on HIV and AIDS. The COVID-19 pandemic has more than ever highlighted the need for comprehensive measures to strengthen the health system and improve preparedness to fight epidemics. In the process of responding to the pandemic, the health system of Armenia utilized the capabilities and pathways created within the framework of national programs to combat HIV and AIDS, and were very important assets in the fight against COVID-19. However, at the same time, difficulties arose in the meeting of the UN goals on fighting HIV, AIDS, and achieving the 2030 Agenda for Sustainable Development all over the world. Armenia was not an exception. The political declaration on HIV and AIDS highlights the key approaches, the steps needed to prevent AIDS as a public health threat and accelerate the progress towards achievement of the Sustainable Development Goals. Few countries were able to even partially achieve the goals defined in the previous declaration, which is why it is utmost important that the new declaration considers the priorities and the strategic goals of the member states. We are pleased to note that the number of messages highlighted in the political declaration coincide with Armenia's main concerns and priorities, including elimination of stigma, discrimination, and restrictive laws, policies, and practices, and creating favorable social and legal conditions. Keeping vulnerable groups in the spotlight and ensuring maximum service availability. Ensuring access of women and girls to the quality health care. Introduction of universal health coverage. Ensuring multi-stakeholder partnership. Interstate cooperation to create regional mechanisms to combat HIV/AIDS. Dear colleagues, COVID-19 pandemic has overwhelmed health systems, disrupted essential health services, deepened inequalities, and posed serious threats to the education of an entire generation of young people. However, it also displayed the flexibility of the HIV response and the benefits of HIV instruments in health and development sectors. Through the implementation of care and treatment support activities and the distribution of medicines by non-governmental organizations, the community service delivery system, pioneered in the HIV field, was widely applied in the COVID-19 response activities and helped to overcome the barriers caused by the pandemic. It It is also important to mention that HIV is high on the agenda of the international community and ensure its sustainable funding despite the heavy financial costs caused by COVID-19. The global health crisis has made us realize that we cannot continue to invest insufficiently in pandemic preparedness. Outcomes of the HIV programs have demonstrated that too little investment, which are made too late, increase risk and uncertainties, create conditions where millions of people need essential health services, hence further increasing healthcare costs. Ladies and gentlemen, if there is one lesson to learn from COVID-19 pandemic, as long as we fail to reinvigorate our efforts in eradicating the known infectious diseases, we will not be able to fully prepare ourselves for the new ones that are bound to come. Thank you.
I thank the Acting Minister of Health of Armenia for the statement just made. I now give the floor to the distinguished representative of the Philippines to introduce a statement by the Minister.
Thank you, Madam Vice President. I have the honor to introduce the pre-recorded statement by His Excellency Mr. Francisco T. Duque III, Secretary of Health of the Republic of the Philippines. Thank you.
President of the General Assembly, His Excellency Volkan Bozkir, Deputy Secretary General, Her Excellency Amina Mohammed, Excellencies, distinguished delegates, the Philippines has taken significant strides toward ending AIDS by 2030, anchored on the Philippine Development Plan 2017 to 2022 that targets to reverse the increasing trend of new HIV infections by 2022. Two landmark legislations directly impact the Philippines' HIV response, the HIV and AIDS Policy Act and the Universal Healthcare Act. Together, these laws broaden the scope of HIV services for persons living with HIV and key affected populations, including migrants, instituted stronger protective mechanism against HIV-related stigma and discrimination, and ensured equitable access of Filipinos to quality health care and improved health systems through integrated programs and services, including flagship initiatives on HIV/AIDS. Amid the disrupted achievement of the 90-90-90 targets caused by the COVID-19 pandemic, the Philippine health system has adapted to the new normal. We have devised strategies to reach vulnerable communities and deliver person-centered, differentiated HIV prevention, testing, treatment, and care services by deploying home-based services and bridging access to these much-needed HIV services, among others. The Philippines also continues to work with international partners, such as the ASEAN Task Force on AIDS, the UNAIDS Secretariat, and the Global Fund to fight AIDS, tuberculosis, and malaria, as well as with civil society organizations whose vibrant participation provides crucial support to our efforts. Further, the Philippines renews its commitment to the 2021 UN Political Declaration and the Global AIDS Strategy through the following priority strategies: extending access to HIV prevention, testing, and treatment services to homes and communities; continuously increasing access to HIV prevention by integrating safe and quality treatment and care services within healthcare provider networks; and strengthening multi-sectoral support and boosting participation of civil society, communities affected, and PLHIV for a more inclusive policy development and program implementation. The Philippines looks forward to continuing and contributing in our collective work for a synergistic, focused, and intensive approach in achieving the best possible health outcomes for PLHIV and vulnerable populations, and providing universal access to HIV services. Thank you and mabuhay!
I thank the Secretary of Health of the Philippines for the statement just made. I now give the floor to the distinguished representative of Australia to introduce a statement by the Minister.
Madam Vice President, colleagues, it's my distinct pleasure and honour to introduce a message from Senator the Honourable Maurice Payne, Minister for Foreign Affairs and Minister for Women of the Commonwealth of Australia.
Mr. President, Excellencies, distinguished delegates, Australia is proud of our long history supporting efforts to address the HIV epidemic, both here in Australia and in our region, the Indo-Pacific. We know that community-led testing, treatment and prevention are the pillars of an effective HIV response. In the Indo-Pacific, Australia is partnering with UNAIDS to implement a new program that increases the availability and uptake of HIV testing and prevention services amongst key populations. This complements our substantial investments in the Global Fund, in UNAIDS and bilateral and research programs. Sexual and reproductive health and rights are also critical to the HIV response, including access to quality, age-appropriate, comprehensive sexuality education for all young people. COVID-19 has seriously disrupted access to these vital life-saving services, particularly impacting women and girls. That's why I'm pleased to announce a major new $44 million investment through key partners to address the urgent unmet need for sexual and reproductive health and rights services and information in targeted communities in the Indo-Pacific region. There's a long road ahead, but we must remain focused. This meeting comes at a critical time in the global HIV response as we observe the 40th anniversary since AIDS was first identified. In 2011, we changed the way we thought about treatment and prevention. And in 2016, we committed to accelerating and scaling up our efforts to eliminate HIV/AIDS. Although we have made progress, there is more to do. Globally, in 2020, we didn't meet our targets. The COVID-19 pandemic isn't the only reason for this, but it has exposed the fragility of the gains we've made and exacerbated the inequalities that drive the AIDS epidemic. This week, we have advanced our shared commitment to ending AIDS. I'm proud of Australia's role with Namibia, co-facilitating the political declaration which puts human rights, science, and addressing inequalities at the centre of the HIV response. We have set ambitious goals necessary to put the response back on track. We have the tools to address this epidemic, and we know what works. Partnerships between governments, affected communities, researchers and clinicians, together with evidence-based programs targeting key populations. In Australia, this approach has resulted in the lowest number of new HIV diagnoses in 20 years. I'm pleased that we have representatives from civil society, including those living with HIV and researchers, joining our delegation. Mr. President, let's use this high-level meeting to galvanise all our efforts. Governments, international organisations, civil society and affected communities to end AIDS by 2030. Thank you.
I thank the Minister of Foreign Affairs and Minister for Women of Australia for the statement just made. I now give the floor to the distinguished representative of Cambodia to introduce a statement by the Minister.
Thank you, Madam President. I have the honor to introduce the pre-recording statement by His Excellency Mr. Muli Ieng, Senior Minister and Chairman of the National AIDS Authority of the Kingdom of Cambodia. I thank you.
Ladies and gentlemen, first, on behalf of the Royal Government of Cambodia, I congratulate the General Assembly for the adoption of the political declaration on HIV and AIDS, ending inequality and getting on track to end AIDS by 2030. At this turning point of global history, Cambodia is committed to the achievement of the 95-95-95 target by 2025. Cambodia is one of 7 countries globally to have achieved the 90-90-90 target in 2017. This achievement has been driven by good partnership between national and subnational institutions with development partners, civil society organizations, key representatives of PL-HIV, and the vulnerable population network throughout the countries. Based on a modeling exercise, Cambodia will not be on track to reduce new infection up to the 2025 target. Insufficient funding for HIV prevention hinders the expansion of the innovative intervention addressing most vulnerable young key population, especially MSM and TG. In Cambodia, the knock-on impact of the COVID-19 pandemic has created additional setbacks and caused danger of underinvestment in public health, system for health, and pandemic preparedness. On our roadmap toward sustainable response to HIV and AIDS, Line Ministry and concerned institution has been implementing 6 policy measures listed in the government's recommendation letter number 213 issued by the Council of Ministers in February 2019. These recommendation letters provides a blueprint for transformative action in health and other related sectors to support the national movement from the central to local level, focusing on strengthening the country system in close partnership with community network to address the root cause of inequality in public services. To leave no one behind, we are determined to apply a people-centered and integrated approach. This approach should be applied in broader government policy and reforms such as universal health coverage, social protection, and other efforts to attain the Cambodia Sustainable Development Goals. Over the next 5 years, we pledge to take urgent action through a coordinated national HIV response based on global solidarity and shared responsibility to fully implement the commitment, goals, and targets contained in the political declaration. Finally, with our determination to move from dependency to resilience, we would like to express concern to the impacts of COVID-19. In this regard, we would like to appeal to developed countries to reconsider the Overseas Development Assistance, ODA, and to readjust it to suit with the country situation in order to retain the gains of our previous response and to close the gap that are preventing progress toward ending aid. Thank you for your attention.
I thank the Senior Minister and Chairperson of the National AIDS Authority of Cambodia for the statement just made. I now give the floor to the distinguished representative of Ghana to introduce a statement by the Minister.
Madam President, I have the distinct pleasure and honor to introduce the pre-recorded statement of His Excellency Kweku Agyeman Menu, the Minister for Health of the Republic of Ghana. Thank you, Madam Chair. Madam.
The President of General Assembly and distinguished delegates, the Government of Ghana recognizes this high-level meeting as an important opportunity to further renew our commitment to the political declaration on HIV and AIDS. We are appreciative of this high-level meeting being held at this time and wish to affirm Ghana's commitment to adopting the political declaration on AIDS to accelerate our efforts at delivering evidence-based, patient-centered strategies to achieve epidemic control. Since the 2016 political declaration, Ghana has made efforts to address the epidemic at the national level. For instance, Ghana passed a new Ghana AIDS Commission Act 938 with the Legislative Instruments Regulations 2020 that make pragmatic provisions for protecting the rights of persons living with HIV and key affected populations in line with the 1992 Constitution. The Ghana AIDS Commission has collaborated with other partners to develop a human rights strategy to protect the rights of people living with HIV and people at higher risk and address inequalities and barriers to HIV and TB services. Additionally, early this year, the government of Ghana signed a $204 million agreement with the Global Fund to support HIV, malaria, and TB interventions. An additional $34 million to enhance the nation's COVID response was also received. While we acknowledge the continued funding from the Global Fund over many years, we recognize that a huge funding gap exists, which my government seeks to address through the operationalization of the National HIV and AIDS Fund as enshrined in the Act 938. This fund serves as a domestic funding mechanism to complement donor funding for a sustainable HIV and AIDS response. The government of Ghana shall provide $100 million as seed money for the fund over the next 5 years for the implementation of the National HIV and AIDS Strategic Plan. It is our honest expectation that the international partners will provide technical assistance and build capacity of lower middle income countries to develop innovative and sustainable domestic financing mechanisms for HIV and AIDS, provide seed money for such funds, grant debt reliefs to free up funds to finance universal health coverage roadmaps. As part of the Common African Position on enhancing domestic production and use of health commodities, the government of Ghana shall continue to invest in the local manufacturing of HIV and AIDS commodities, vaccines, diagnostics, and antiretroviral medicines. Government and people of Ghana wish to acknowledge the UN AIDS for developing the Global AIDS Strategy 2021-2026 that aims at reducing the inequalities that drive the HIV epidemic and outlines evidence-based priority actions and ambitious targets to keep countries on track to end AIDS as a public health threat by 2030. Ghana is committed to reducing the HIV/AIDS infection rate, especially in vulnerable populations, and also committed to working with relevant stakeholders. I thank you, Mr. President.
I thank the Minister of Health of Ghana for the statement just made. I now give the floor to the distinguished representative of the Netherlands to introduce a statement by the Minister.
Thank you, Madam President. And I have the honor to introduce the pre-recorded statement by Ms. Sigrid Kaag, Minister of Foreign Affairs of the Kingdom of the Netherlands.
Excellencies, distinguished guests, around the world, 38 million people are living with HIV. Their lives and the lives of their loved ones are permanently affected by this chronic disease in more ways than one. Intersecting inequalities often lie at the heart of infection, along with stigmatization, discrimination, and even criminalization. All these exclude people from the life-saving testing and treatment they need. COVID-19 has made it even harder to get tested, let alone treated. As such, it deepens existing inequalities and hampers access to health care. But we can overcome this. After 40 years of HIV response, we know what works. What works is recognizing reality and respecting human rights. Adolescent girls and young women, men who have sex with men, sex workers, people who use drugs, transgender people, and prisoners, all of these are key populations who pay the highest price for our collective failure to stop the spread of HIV. If we truly value and celebrate human diversity, we must acknowledge the right of people to be who they are, wherever they are. Sex is part of this, and it should be safe and enjoyable for everyone. That's why, in the Kingdom of the Netherlands, high-risk groups receive free access to sexual health care. People who use drugs are offered harm reduction to help them live stable lives, and all stakeholders work together closely to prevent HIV infections. It works. It works because it recognizes the realities of life in all of its facets. We try to take the same approach in our international efforts to advance sexual and reproductive health and rights. This is why we support UNAIDS in its efforts to mobilize the entire UN system in the response to HIV/AIDS. We cannot afford to lose progress made over the last 2 decades. At the same time, if we talk about facing the realities of life, we need to face the fact that global efforts are still falling short. So the Netherlands welcomes the new global AIDS strategy. End inequalities, end AIDS. This will help get the AIDS response back on track. Countries in Eastern and Southern Africa are showing us the way. In these regions, constructive political leadership, an active civil society, and community responses have delivered a 38% decline in new HIV infections. The world should rally behind the people and countries that are affected the most. They're counting on us. Let's not fail them. Thank you.
I thank the Minister of Foreign Affairs of the Netherlands for the statement just made. I now give the floor to the distinguished representative of the United Kingdom to introduce a statement by the Minister.
Thank you, Madam Chair. I have the pleasure this evening to introduce a pre-recorded statement by Wendy Morton, Minister for European Neighbourhood and the Americas at the Foreign, Commonwealth and Development Office.
"40 years on from the devastating emergence of AIDS, the UK is proud to stand with all those affected directly and indirectly by the virus, and with all our partners who have been instrumental in the global response to the HIV pandemic. Together, we have made significant progress. Over 25 million people now receive treatment that not only prevents death, but allows people to thrive. I commend the Secretary-General for his excellent recent report, and I thank the ambassadors of Australia and Namibia for their tireless work, bringing countries together to speak with one voice. I also thank UNAIDS and its co-sponsors for their continued leadership. The UK welcomed the new global AIDS strategy. It rests on all of us to deliver it and to end the AIDS epidemic by 2030. AIDS remains the leading killer of women of reproductive age, and key populations are disproportionately vulnerable to new HIV infections. So clearly we need to drive down HIV infections in all these groups. The UK has invested substantially in the WHO and the Global Fund, which work alongside national governments to address their HIV epidemics. And I'm delighted to announce that the UK government will contribute a further £7 million over the next 3 years to the Robert Carr Fund. This will be used to support civil society networks to provide vital health services and to advocate for the rights of inadequately served populations. Tragically, one of the biggest barriers to ending AIDS is a lack of political will that flows from a lack of respect for the rights of women, adolescents, LGBTQ people and minorities. The same is true of AIDS as it is of COVID-19. We cannot put it behind us until every country is able to do so. So we need to follow the public health evidence to protect and empower the most marginalised in their societies. The UK has long been a defender of sexual and reproductive health and rights for all, and we will continue to use our voice on the world stage to fight for gender equality and human rights. We should not leave anyone behind. This is our moral duty and a public health necessity. It is the only way to end the AIDS epidemic once and for all.
I thank the Minister for European Neighbourhood and the Americas at the Foreign, Commonwealth and Development Office of the United Kingdom for the statement just made. I now give the floor to the distinguished representative of the Russian Federation to introduce a statement by the Minister.
Благодарю вас, уважаемая госпожа председатель. Имею честь представить предварительно записанное видеовыступление министра здравоохранения Российской Федерации Михаила Альбертовича Мурашко.
Уважаемый председатель, уважаемые коллеги,
Российская Федерация приветствует проведение заседания высокого уровня Генеральной Ассамблеи Организации Объединенных Наций по ВИЧ и СПИДу и выражает приверженность глобальным целям по ВИЧ-инфекции 95-95-95. Для достижения упомянутых целей в эпоху COVID-19 как никогда важным становится фактор социальной и финансовой ответственности государства за здоровье своих граждан. Имеющееся перераспределение финансов, связанное с пандемией COVID-19, не должно сказываться на реализацию мер по противодействию распространению ВИЧ-инфекции. Российская Федерация в условиях COVID-19 приняла новую государственную стратегию по ВИЧ-инфекции до 2030 года. За счет полного государственного финансирования в ее рамках формируются адресные программы и системно объединяются усилия по тестированию и профилактике. Людям, живущим с ВИЧ, по-прежнему предоставляется бесплатное лечение антиретровирусными препаратами и оказывается социальная поддержка. За последние 4 года Российская Федерация совместно с некоммерческими организациями удалось добиться снижения количества новых случаев ВИЧ более чем на 26 тысяч. Увеличиваются охваты тестированием на ВИЧ-инфекцию и антиретровирусной терапии. Практически элиминирован вертикальный путь передачи. Достигнутый прогресс не был подорван даже пандемией COVID-19, благодаря слаженным и оперативным мерам. Развитие науки – неотъемлемая часть в ответ на ВИЧ. В эти дни в Москве проходит научная конференция с привлечением экспертов высокого международного уровня, призванная рассмотреть актуальные вызовы ВИЧ и предложить подходы к их решению. Мы признаем важность международного сотрудничества, работая не только в стране, но и в регионе. С 2013 года Российская Федерация финансирует программу технической помощи по ВИЧ странам Восточной Европы и Центральной Азии. Отмечаем необходимость солидарности стран в реализации поставленных перед нами целей. Лишь совместными усилиями, но с учетом национальных контекстов, мы можем положить конец СПИДу. Спасибо за внимание.
I thank the Minister of Health of the Russian Federation for the statement just made. I now give the floor to the distinguished representative of Cuba to introduce a statement by the Minister.
Gracias, señora Presidenta. Tengo el honor de presentar el discurso pregrabado del Ministro de Salud Pública de la República de Cuba, doctor José Ángel Portal Miranda. Gracias.
Señor Presidente, 20 años después de la declaración de compromiso en la lucha contra el VIH-Sida, las desigualdades en el acceso a la salud no solo persisten, sino que en muchas naciones se acrecientan. A ese injusto escenario se ha sumado el impacto negativo de la pandemia provocada por la COVID-19, que influye de forma negativa en la implementación de las metas globales de la Agenda 2030 e impone restricciones a su plena consecución. En medio de esas adversidades, esta reunión nos brinda la oportunidad de compartir los progresos alcanzados y ratificar nuestro compromiso de poner fin a la epidemia del SIDA como un legado a las generaciones presentes y futuras. Cuba ha concebido el abordaje a la respuesta al VIH con un enfoque de salud pública, insertado en la atención primaria, centrado en las personas y con participación intersectorial y de las poblaciones claves, atendiendo las necesidades propias de cada grupo. En nuestro país, la mortalidad relacionada con el SIDA disminuye progresivamente y la incidencia de esta enfermedad muestra una tendencia a la estabilización. Uno de los indicadores positivos es que las personas menores de 15 años no están prácticamente afectadas por esta epidemia. En el 2015, la Organización Mundial de la Salud nos otorgó la condición de primer país del mundo en eliminar la transmisión madre a hijo del virus de la inmunodeficiencia humana y la sífilis. Dicha condición fue revalidada en los años 2017 y 2019, manteniendo en la actualidad el cumplimiento de tales propósitos. Con regocijo podemos decir que en los años 2019 y 2020, por ejemplo, Cuba no reportó ningún contagio por VIH de madre a hijo. Entre las muchas acciones que se llevan a cabo en el país, podemos destacar la implementación de un programa de prevención, diagnóstico y tratamiento antirretroviral. Anualmente se realizan alrededor de 2 millones de pruebas serológicas, de ellas más de 300.000 a gestantes, con una cobertura de tamizaje y de tratamiento antirretroviral que sobrepasa el 99%. Además, hemos logrado avanzar de manera sostenida en la sensibilización de la sociedad en relación a la eliminación de estereotipos de género y patrones sexistas que desfavorecen a la mujer. Hoy existe entre nuestra población más comprensión y aceptación de la diversidad sexual y hacia las personas que viven con esta enfermedad. Con la implementación del nuevo plan estratégico se garantiza una mayor calidad de vida a las personas con VIH, así como la disminución progresiva de los contagios con nuevas infecciones. De esta manera, se han logrado altas coberturas de tratamiento y se hacen esfuerzos por disminuir la carga viral circulante e incrementar la adherencia terapéutica, acercándonos a la meta 90-90-90. Señor presidente, aun cuando el enfrentamiento a la COVID-19 ha demandado un esfuerzo extraordinario en todos los ámbitos para mi país, en medio de una asfixiante guerra económica y la aplicación de inhumanas medidas coercitivas unilaterales que nos han limitado el aseguramiento médico para el manejo de esta y otras enfermedades, nada nos ha impedido continuar consolidando las acciones de prevención y la atención a quienes se han contagiado con el SIDA. En este escenario, Cuba renueva su compromiso de continuar garantizando el disfrute del derecho a la salud de todo nuestro pueblo y la respuesta mundial y regional al VIH-Sida. Solo la integración, la solidaridad internacional y la acción conjunta entre nuestros países y gobiernos asegurarán el éxito frente a las pandemias del VIH-Sida y de la COVID-19. Es la manera de hacer que permitirá lograr una respuesta efectiva ante futuras emergencias sanitarias. Muchas gracias.
I thank the Minister of Public Health of Cuba for the statement just made. I now give the floor to the distinguished representative of Morocco to introduce a statement by the Minister.
Merci Madame la Présidente. Excellences, Mesdames et Messieurs, à l'occasion de la tenue de la réunion de haut niveau de l'Assemblée générale sur le VIH-Sida 2021, j'ai l'honneur de vous présenter le discours national préenregistré du Royaume du Maroc, prononcé par son Excellence professeur Khalid Aït-Taleb, ministre de la Santé du Royaume du Maroc.
Monsieur le Président de l'Assemblée générale, Monsieur le Secrétaire général des Nations Unies, Excellences, Mesdames et Messieurs, la communauté internationale est mobilisée depuis plus de 3 décennies pour la lutte contre le sida, avec d'énormes progrès dans la riposte mondiale suite à l'adoption en 2001 de la déclaration d'engagement sur le VIH. Et nous voilà à nouveau réunis 20 ans après, en vue d'agir ensemble pour mettre fin à l'épidémie d'ici 2030, conformément aux objectifs du développement durable. Cette réunion de haut niveau nous permettra d'évaluer les efforts déployés depuis la dernière déclaration de 2016, d'identifier les carences dans la riposte mondiale et de convenir des priorités communes pour intensifier les efforts, accélérer la riposte et garantir aux personnes vivant avec le VIH et aux personnes vulnérables l'accès à des services de qualité dans un parfait respect de leurs droits. Tout en souscrivant pleinement à cette approche, le Royaume du Maroc se félicite des efforts déployés en matière de lutte contre le sida sous le leadership de Monsieur le Secrétaire général et le dynamisme de l'ONU-SIDA, tant au niveau global et régional qu'à l'échelle des pays. Excellences, Mesdames et Messieurs, le Maroc est mobilisé pour la lutte contre le sida depuis le début de l'épidémie, avec une culture ancrée de partenariat entre les départements gouvernementaux et les organisations de la société civile, bénéficiant d'un engagement politique au plus haut niveau et soutenu par les réformes et les chantiers menés sous la conduite éclairée de Sa Majesté le roi Mohamed VI, que Dieu l'assiste. À ce titre, il convient particulièrement de citer l'Initiative nationale pour le développement humain pour lutter contre l'exclusion sociale et la précarité, le nouveau modèle de développement du Maroc récemment lancé visant à réduire les inégalités pour un Maroc prospère, inclusif et solidaire, et l'extension de la protection sociale en cours pour ne laisser personne pour compte, convergeant notamment vers la couverture sanitaire universelle dans le cadre de la réforme profonde du système de santé. Excellences, Mesdames et Messieurs, dans le contexte particulier lié à la riposte contre la pandémie Covid-19, notre pays a consenti d'importants efforts pour en atténuer l'impact sur les programmes nationaux de santé en général et sur celui de la lutte contre le sida en particulier en instaurant des mesures exceptionnelles pour assurer la continuité des services de prévention et de traitement, ainsi que pour réduire l'impact psychologique, économique, social sur les personnes vivant avec le VIH. Le Royaume du Maroc fait part avec une réelle satisfaction des progrès réalisés dans le cadre des plans stratégiques nationaux de lutte contre le sida, selon une approche basée sur la concertation et la mobilisation de l'ensemble des partenaires et le respect de l'équité et des droits humains. Nous sommes fiers d'annoncer que selon les dernières estimations, le nombre de nouvelles infections VIH et de décès liés au sida au Maroc ont diminué de 50% depuis l'année 2010. Et le pourcentage des personnes vivant avec le VIH qui connaissent leur statut sérologique a atteint 81% et la couverture par le traitement rétroviraux est de 76%. Depuis 2019 dans notre pays. Nous saisissons cette occasion donc pour remercier l'ONU-SIDA et le Fonds mondial pour leur appui à la lutte contre le sida au Maroc. Malgré tous les efforts déployés, la détermination à toujours mieux faire continue à guider nos démarches. Le plan stratégique de lutte nationale contre le sida s'est assigné pour objectif d'ici 2023 de réduire 50% les nouvelles infections VIH et la mortalité liée au sida, lutter contre la discrimination et renforcer la gouvernance et la riposte nationale. Excellences, mesdames et messieurs, le Royaume adhère pleinement à la nouvelle vision mondiale de lutte contre le sida pour la période 2021-2026, certes audacieuse mais réalisable. Nous espérons que cette réunion de haut niveau aboutisse à l'adoption d'une déclaration forte permettant à la communauté internationale d'agir avec unité et détermination et de mobiliser les ressources suffisantes, en particulier pour notre continent africain. Ensemble, nous pouvons renforcer la solidarité internationale, partager et capitaliser nos expériences et nous gagnerons le combat pour mettre fin à l'épidémie du sida en 2030. Le Maroc y est déterminé. Je vous remercie pour votre attention.
I thank the Minister of Health of Morocco for the statement just made. I now give the floor to the distinguished representative of Brazil to introduce a statement by the Minister.
Thank you. Madam Vice President, I have the honor to introduce the pre-recorded video message of His Excellency Marcelo Queiroga, Minister of Health of Brazil, to this high-level meeting on HIV and AIDS.
Senhor Presidente da 75ª UNGA, Embaixador Volkan Bozkır, Senhora Secretária-Geral Adjunta, Anima Mohamed, Senhora Diretora Executiva da UNAIDS, Winnie Bianima, Senhoras e senhores, nossos compromissos internacionais trouxeram resultados substantivos no controle da epidemia de HIV, reduzindo expressivamente os novos casos e a mortalidade de AIDS, bem como a transmissão vertical. No entanto, o número de novas infecções de HIV ainda supera em muito a meta global almejada para 2020. No Brasil, temos o orgulho de garantir, desde 1996, o tratamento para o HIV de forma universal e gratuita, por meio do nosso Sistema Único de Saúde, SUS. Cerca de 730 mil pessoas são assistidas com antirretrovirais, sendo metade deles de produção nacional. Mesmo diante das adversidades impostas pela pandemia da Covid-19, mantivemos a oferta de medicamentos para tratamento e profilaxia sem desabastecimento, em respeito ao princípio da solidariedade internacional que nos guia. Mantivemos também nossas doações de antirretrovirais, antivirais e testes rápidos a países da América Latina e Caribe. Nosso programa de vacinação contra a Covid-19 priorizou pessoas vivendo com HIV/AIDS. O Brasil se compromete com o fim da AIDS e destaca a meta nacional de ter ao menos 40 mil pessoas acessando a PrEP até dezembro de 2021. Reiteramos a necessidade de ampliarmos o acesso a todas as ferramentas de prevenção do HIV, sobretudo para populações-chave. Sabemos que os impactos desta epidemia são desiguais, concentrados tanto em alguns países quanto em grupos menos favorecidos. É fundamental atuarmos para que o estigma e a discriminação, ainda fortemente vivenciados por esses grupos, não os afastem do cuidado ao HIV. Seguimos defendendo o modelo de acesso universal à saúde e a necessidade de se construir respostas ao HIV integrais e sustentáveis, baseadas na defesa dos direitos humanos, no diálogo com a sociedade civil, no investimento em pesquisa e na incorporação oportuna de novas tecnologias de saúde. Ainda há muito a ser feito para alcançarmos o fim da AIDS. Hoje, ao renovar nossos compromissos, nos colocamos mais perto do nosso objetivo. Contem conosco. Obrigado.
I thank the Minister of Health of Brazil for the statement just made. I now give the floor to the distinguished representative of Nicaragua to introduce a statement by the Minister.
Muchas gracias, señora vicepresidenta. Tengo el honor de presentar mensaje pregrabado de su excelencia, doctora Marta Reyes, ministra de Salud de nuestro Gobierno de Reconciliación y Unidad Nacional de Nicaragua. Muchas gracias.
Buenos días, saludamos a la presidencia de los países participantes en esta sesión de ONU-SIDA. El Gobierno de Reconciliación y Unidad Nacional agradece la invitación a esta sesión de relevante importancia para asegurar la restitución del derecho a la salud de las personas afectadas por el VIH. En relación a los avances, Nicaragua registra una epidemia de tipo concentrada, manteniendo una prevalencia mayor al 5% en población clave. Cumple con la existencia de la Comisión Nicaragüense del SIDA, CONICIDA, que articula la respuesta ante el VIH de forma coordinada. Cuenta con una ley de promoción, protección y defensa de los derechos humanos ante el VIH y SIDA para su prevención y atención, y el Plan Estratégico Nacional de Respuesta ante las ITS VIH que conforman nuestros 3.1. Para asegurar todos los procesos de restitución de derechos a las personas con VIH, el Ministerio de Salud ha avanzado en brindar una atención con calidad y entrega de tratamiento gratuito a todos, así como los exámenes complementarios que necesitan los protagonistas. De esta manera, es importante resaltar los siguientes aspectos: el aseguramiento de 84 clínicas de atención integral para el VIH, aplicación de la resolución ministerial 671 de 2014 del MINSA que orienta la protección y garantiza el respeto a la dignidad e identidad de las poblaciones clave y personas con VIH, asegurando espacios libres de estigma y discriminación en las unidades de salud del país. Implementación de la política de prevención ante las ITS VIH, desarrollo del Plan Nacional para el Abordaje, Atención Integral y Seguimiento de Poblaciones Clave, implementación de la Estrategia Nacional de Oferta de Pruebas de VIH a poblaciones clave, fortalecimiento del sistema de registro de vigilancia epidemiológica para las VIH. Referente al avance en derechos humanos, contamos con una procuradora de la diversidad sexual que fiscaliza, evalúa y valora el cumplimiento del respeto de los derechos humanos de estas poblaciones y de personas con VIH. En relación al proceso de atención, se ha fortalecido la estrategia de eliminación de la transmisión materno-infantil del VIH y la sífilis congénita, con una cobertura en control prenatal del 95% en el año 2020. Se garantiza el seguimiento de la niñez expuesta al VIH. Se aplica un plan de respuesta ante emergencia y ante la amenaza de la pandemia COVID-19, incorporando aspectos de autocuidado para esta enfermedad. Se desarrolla campaña permanente en unidad con las organizaciones de personas con VIH para lograr la adherencia de las personas con VIH en abandono. En relación al derecho, la libertad y seguridad personal, el MINSA y la CONICIDA, tanto a nivel nacional como departamental, desarrollan sesiones ordinarias de la CONICIDA en donde cada mes diferentes instituciones y actores, miembros de la respuesta, exponen y analizan los avances y retos de la respuesta local y nacional. Muchas gracias.
I thank the Minister of Health of Nicaragua for the statement just made. I now give the floor to the distinguished representative. And I'm sorry. So that's it. That's the last speaker. No. Yeah. Sorry, that was the last speaker. We have heard the last speaker for this meeting. We shall continue with the list of speakers for the general debate of the high-level meeting tomorrow afternoon at 3 p.m. in this hall. Members are also reminded that the fourth thematic panel entitled Advancing Gender Equality and Empowering Women and Girls in the AIDS Response, chaired by Her Excellency Karina Gould, the Minister of International Development of Canada, and moderated by Ms. Shireen El-Faki, Director of the Regional Support Team for the Middle East and North Africa at the Joint United Nations Programme on HIV/AIDS, will take place tomorrow morning at 10 a.m. in this hall. Before adjourning, may I kindly request delegates to leave the hall while maintaining physical distancing. I thank you for your cooperation. The meeting is adjourned.